Today's breaking news: bombshell. We all have already seen and know that Tammy Slaton of 1,000-Pound Sisters episode has become more beautiful than Bollywood heroine after skin remover surgery. We all know that the love rumors between Cody Brown of Sister Wives episode and Tammy Slaton of 1,000-Pound Sisters were being heard on social media for a long time. Tammy's surgery: it is more intoxicating to see Tammy's appearance, youth, and appearance. Cody Brown proposed to Tammy Slaton's family yesterday. We all know that all of Cody Brown's wives divorced him except Robin Brown. But due to conflict between Cody and Robin Brown over property division, Robin Brown also left him. Taking advantage of this opportunity, Cody Brown fell in love with Tammy Slaton and married her today. Tammy Slaton has loved Cody Brown since her husband Caleb died. An abdomen marked a transformative moment in her ongoing story. Conducted by Dr. J. Peter Rubin, MD, Chair of the Department of Plastic Surgery at UPMC, University of Pittsburgh Medical Center, and Director of the UPMC Life After Weight Loss Program, the procedure left both Tammy and her fans in awe of the results. In an exclusive interview with Tyla, Dr. Rubin shared a detailed account of the surgical process, from pre-operative evaluations to the unique challenges of operating on a patient with such significant weight loss. Meanwhile, the emotional dynamics between Tammy and her sister Amy Slaton have captivated audiences, with Amy's reactions to Tammy's achievements revealing a complex mix of support and apparent envy, particularly evident in Season 7 of the show. The surgery required meticulous preparation to ensure Tammy's safety and optimize outcomes. Dr. Rubin explained, Tammy underwent a comprehensive pre-surgical evaluation, which included a thorough review of her medical history, a detailed physical examination, coordination with her other healthcare providers, and an extensive assessment by our anesthesia team. This rigorous process helped identify any potential risks and guided the surgical plan. Additional tests were ordered to enhance safety, and specific health benchmarks were set for Tammy to meet before proceeding. One significant obstacle was her vaping habit, as nicotine poses serious risks to wound healing and anesthesia. Nicotine use, whether from smoking or vaping, significantly increases the likelihood of complications, Dr. Rubin noted. Tammy's dedication to quitting vaping was remarkable, especially given how challenging it is to break a nicotine addiction. We routinely test for nicotine to protect our patients. Her success in overcoming this hurdle was a critical step toward surgery approval. The operation itself was tailored to Tammy's unique needs, reflecting the specialized nature of plastic surgery after massive weight loss. Dr. Rubin described employing modified techniques for abdominal paniculectomy, brachioplasty arm lift, and face neck lift, customized to Tammy's anatomy. We design each procedure to address the patient's specific concerns while prioritizing safety, he said. The surgical plan was carefully crafted to Tammy's most pressing aesthetic and functional issues, while also allowing for potential future procedures if she chose to pursue additional skin removal. Operating on a patient who had lost 500 pounds presented distinct challenges, particularly due to changes in vascular anatomy. At higher body weights, arms and veins enlarged to supply blood to excess tissue, Dr. Rubin explained. After weight loss, these oversized vessels remain, increasing bleeding risks and making surgery more complex. Additionally, anatomical structures may shift, demanding constant attention.
Wound complications are common in these surgeries, even under ideal conditions, he said. Tammy's commitment to optimizing her health made a significant difference. He also reflected on the emotional challenges of his role, noting, one of the toughest moments is telling a patient like Tammy, who has worked so hard, that they're not yet ready for surgery. Tammy's ability to meet these demands highlighted her resilience and determination. While Tammy's surgical success has been a highlight of 1,000-Pound Sisters Season 7, her relationship with Amy has drawn significant attention. Viewers have noted Amy's reactions to Tammy's milestones, particularly her skin removal surgery, often interpreting them as tinged with jealousy. Amy's responses frequently appeared subdued or quickly shifted to her own personal challenges, a pattern that became evident throughout the season. For example, when Dr. Eric Smith approved Tammy's surgery, Amy offered a brief, seemingly insincere congratulations before redirecting the conversation to her relationship with Brian Lovewarn. This tendency to deflect attention from Tammy's achievements was a recurring theme, frustrating many fans. The season finale underscored this dynamic as Tammy shared her excitement about her surgical results. Her confidence and joy were unmistakable, yet Amy's reaction seemed restrained, with body language and facial expressions suggesting unease. Viewers described Amy's demeanor as an effort to appear supportive while wrestling with feelings of inadequacy. This was particularly evident when Tammy revealed her transformed facial appearance post-surgery. While Tammy glowed with pride, Amy's responses felt distant, often pivoting to her own life events, such as her engagement to Brian. Fans found this pattern disappointing, as it seemed to diminish Tammy's hard-won milestone. The tension between Tammy and Amy goes beyond typical sibling rivalry, reflecting deeper emotional complexities. Amy, who has also undergone weight loss and skin removal surgeries, may struggle to reconcile her own journey with Tammy's highly publicized success. This dynamic is intensified by the public nature of their story, played out on national television, where every reaction is magnified. Amy's tendency to redirect conversations to her own narrative, particularly her relationship with Brian, appears to be an attempt to regain focus, a behavior that contrasts sharply with Tammy's moments of triumph. A pivotal moment occurred when Tammy discussed her surgery approval process. Amy's fleeting acknowledgement was swiftly followed by a shift to her own concerns, a move that felt dismissive to viewers. This pattern of deflection persisted, with Amy's engagement announcement seeming timed to draw attention away from Tammy's health achievements. Fans expressed frustration at Amy's apparent difficulty in fully celebrating her sister's progress, viewing it as a missed opportunity for authentic support. The contrast between Tammy's exuberance and Amy's reserve highlighted an emotional gap, underscoring the challenges of navigating personal success within a shared public platform. Dr. Rubin's insights into the surgical process provide a grounding perspective, emphasizing the technical and medical intricacies of Tammy's achievement. His focus on individualized care and rigorous preparation highlights the complexity of her journey. The surgery demanded not only physical readiness, but also mental fortitude, as Tammy overcame significant barriers, including her nicotine addiction, to qualify. Her rapid recovery further underscores her strength and commitment to her health. The interplay between Tammy's surgical triumph and Amy's emotional responses paints a nuanced picture of their relationship. Tammy's journey is one of overcoming adversity, supported by medical expertise and fan encouragement, while Amy's reactions reveal the difficulty of supporting a sibling's success amid personal insecurities. For viewers, this dynamic adds depth to 1,000-pound sisters, showcasing the complexities of family bonds under public scrutiny. Tammy's transformation continues to inspire, while Amy's struggle to fully embrace her sister's achievements prompts reflection on the nature of support and envy in close relationships. As Tammy progresses, her story remains a powerful testament to resilience, bolstered by professionals like Dr. Rubin and the